Okay, so afterload is going to be, and I'm going to kind of say it the incorrect way and then kind of revise myself, but one way to think of afterload is diastolic pressure. It's the opening pressure of the aortic valve, and that is true most of the time. There are exceptions, which I'll talk about. The technical definition of what afterload is it's actually has to do with the left ventricle, and it's the stress on the left ventricle wall, left ventricle wall. So left ventricle wall stress. But usually that's the same thing as the pressure to open the aortic valve. So because once you open the aortic valve, then the stress on the left ventricle is equal to the pressure in the aorta. So normal flow volume loop here once again, and we've changed one thing, and that one thing is afterload. And so you can see here at a different afterload, the valve opens at a higher pressure, and then it ejects, and it ends right here. So you can see here we have not changed contractility, because look at that, all three of these end on the same. And what is it again? PIP, and what does that stand for? Peak isovolumic pressure. Okay, so this right here would be a wonderful example of hypertension. If somebody has hypertension, that means that their blood pressure is higher. The normal blood pressure is about 120/80, but let's say that they were 140/90, okay? Then what happens is, and let's say this is 90 right here, then what happens is 90 is the baseline pressure, that's diastolic pressure. So to open the aortic valve, the heart has to generate 90 millimeters of mercury of pressure inside of the left ventricle before the aortic valve will open, and then we have ejection, and so the stroke work. So, the reason why the stroke volume is from here to here now is because we have the same amount of stroke work, but that stroke work now is going into getting it to here, getting it to the point where we can open the aortic valve, and then that's why less of the stroke work is going towards the ejection. So what happens to end systolic volume? These are the types of ways they can ask questions about this. The end systolic volume has increased now. The stroke volume has decreased. How about the peak isovolumic pressure? The peak isovolumic pressure has increased. It's this point right here. But the line has not changed. That line has not changed. That line does not change unless there's a change in contractility. So, anyway, so that'd be a really good example with hypertension. You know that the pressure on the other side of the aortic valve is higher, and so the left ventricle has to make more pressure to open that valve. Okay, there's another really good example of increased afterload, and that example is aortic stenosis. So if you remember, if I draw my little square of the heart like this, actually that's a bad idea to do it like that, but where am I going to draw the aortic valve? I'm not. I'm going to scrap this. Okay, so let's just say we have a ventricle, and so this is not what it's supposed to look like, but we have this aortic valve, which is bicuspid, and let's say this aortic valve has stenosed, meaning it's got a little fish mouth now. Things have built up, and it's harder to get blood out. So what's going to happen is the pressure here is going to be lower than the pressure in here, because there's going to be a ton of pressure trying to push this, because the body is telling the brain that it needs the same amount of blood, and the brain's telling the left ventricle to work harder, and so the left ventricle is going to have to go way up in pressure to eject blood out, because now we have a smaller opening, looks kind of like a little fish mouth, and so in that case, this pressure here in the aorta is not really going to represent afterload, because it's going to be lower, because the heart wall is having to contract harder to get past this point here, or actually I shouldn't say that, it'll still open at the same point, but there's just more afterload as far as the left ventricle is concerned, because the technical definition of afterload is the stress on the left ventricular wall and on those cardiac myocytes. So it's a lot higher with mitral stenosis, and it's higher with hypertension. And I hope that makes sense. One other thing that I want to mention, I'm just looking right there, inspiration. Okay, inspiration increases afterload also. Okay, this is a little bit harder to understand, so I'm going to draw two circles to help you understand. Okay, so let's pretend that this first circle is the left ventricle. Okay, and then this is the thorax. This is what this is our what houses our lungs and our heart. So what happens is when we breathe in, we go, and the thorax gets bigger. And what happens when the thorax gets bigger is that there's a drop in pressure. And so 1 atmosphere or 760 millimeters of mercury, we kind of think of that as just being baseline. That's 0. So we end up with a negative pressure, because we generally consider it to be 0 when we're not taking a breath in or a breath out. And so what happens is we end up with a net pressure in here of -7 millimeters of mercury. And so what happens is that -7 millimeters of mercury is pulling on everything, and including pulling air into the lung, but it's also pulling on the heart wall. So we have 7 millimeters of mercury pulling the heart wall out like that. So the heart wall has to overcome that 7 millimeters of mercury in addition to, over here, the aortic valve. So that's the same thing as that's an increase in afterload, because the definition of afterload is the stress on the left ventricular wall. So it has to overcome the 7 millimeters of mercury pulling it open, and then it has to overcome the aortic valve, which just, let's say, is 80 millimeters of mercury to open it. So the afterload would then be 87, for example. So I hope that makes sense, and send me a question if it doesn't. Thanks.